My name's Tobias. I'm a CT technologist. I work at University of Louisville Hospital in Louisville, Kentucky. I've been doing CT scan for about 12 years now. Pretty much just involved in direct patient care. Bring patients in the room, talk to them, set them up, do their scans, and get them on their way.
My name is Dr. Amy Lopes. I am a family practice physician. I work in outpatient setting in San Diego, California. I've been in practice for 23 years. My responsibilities include taking care of patients from as young as about 6 years old to as old as 106. A lot of that is healthcare prevention, but also taking care of their acute medical needs.
My name is Alexandra Eisenhut. I am an RN at Upstate Hospital. I work at Community, which is the smaller of the two campuses. And currently I am a med-surg telemetry, medical surgical, which is pre and post surgery, and pretty much any medical need really. So we get everybody.
The difficulties that you get with COVID of being unable to breathe, the symptoms are similar to having a PE, blood clot, pulmonary embolus. So it was we couldn't really argue to say, no, we don't want to do the scan because they're COVID positive. So it's sort of been interesting to see it go from scanning everyone that might have it to we're not going to scan anybody because it's dangerous to now we have to scan them because they might have something else.
So a lot of people are losing a lot of weight, and you need proteins, you need all kinds of vitamins to be able to rebuild and not create scar tissue in your lungs and just get healthy in general. And a lot of these people at first were from other nursing facilities. So they had a lot of issues to begin with, like wounds and just all kinds of histories for medical history, which you had to also deal with on top of COVID. And people were getting all kinds of fluid in their lungs. So we had to deal with that too. So I had to look up all of that information. What have we done? How can we help them more? Are they stable enough to go home yet? Are they not? How do we get them there?
We have specific outdoor respiratory clinics for those patients exhibiting possible symptoms that need to be tested. So my main interaction with patients with COVID is initially talking with them about their symptoms, ordering the COVID testing, and then relaying their results, and then documenting their results to the health department. And then follow up on those patients that have pretty severe disease that have been in the hospital and need close follow-up afterwards.
So the weird thing was nothing, for most of us, at least at my department, it felt like nothing changed in our lives except that work was much more dangerous. But really with the lockdowns and with the restrictions, and they removed a lot of the elective outpatient surgical procedures, our patient volume went down. So work was actually easier. We spent a lot of time sort of sitting around looking at each other, are we going to do anything today? Are there going to be any patients? And then the ones you did see, it was much more dangerous. And, you were always worried, is this patient going to have COVID? Do they even know? Do they have symptoms? Am I going to get sick from them? So that was a little more stressful. Also, the hospital sort of lost so much money because business was down that while nurses were getting hazard pay because it was more dangerous, they were talking about furloughing people in my department, sending you home early. And then they never came to be, but they had discussed possibly everyone taking a temporary, which I don't know if it would have been temporary, but temporary pay cut so everybody could stay on full time. But yeah, it was kind of, you weren't really sure what was going to happen from day to day.
I find it frustrating at times. I'm a very realistic person. So I just understand it is what it is. And I get frustrated with the nuances of people in society that have different ideas about what the rules are, whether this even exists. Am I tired of it? Yes. Am I frustrated? Yes. I also work in HIV. I didn't disclose that in the beginning. I'm an HIV specialist. So part of my background is a bit of infectious disease. So I don't completely, but I understand the issues around this virus, its elusiveness, its ability to be so transmissive. So I think as a healthcare professional, it's just, you got to do what you got to do. There's no sitting around, at least for me, feeling sorry for myself or woe is me and I don't want to do this anymore. The other personal aspect for me is that my husband's a hospital doctor. So he takes care of many COVID patients and has had many COVID patients die. And so I see the mental health burden on him far more because he's in there one-on-one, and the devastation since the beginning. Um, it's sort of logarithmic I see for him. So, it's not as much for me personally, but the impact on our family is clearly there.
I actually just started anxiety medication, which is not necessarily the best thing, but you got to do what you got to do. Work in and of itself is constantly overwhelming because we have so many people with COVID. The second you get someone to go home, you have a new one back slotted for their bed an hour before they even leave. So as soon as they're out, you clean the room. 10, 15 minutes later, there's a new patient in there because the room needs to be cleaned. Back when we were UVing the rooms, you had at least 45 minutes, but now they get things turned around so quick that you have a new patient and you got to do all this stuff again.
To go, okay, this patient has COVID, and if people say, oh, I don't want to scan them, I was like, I will do it, but give me a mask, give me the eye shields, give me the gowns, that's fine. And a lot of places were telling people that they had to take care of patients without that stuff. And that was really frustrating to watch that happen from time to time. And for them to say, this is the job you signed up for. Well, yes, but I also signed up to do it with the right equipment. You wouldn't send, firefighters into a burning building without, all their gear and their respirators and, their helmets. You didn't say, oh, well, you knew you were going to go into burning buildings. So there's kind of that sort of, for some people, I think the realization that they would be asked to do dangerous things and not have the correct protective gear. But I haven't felt any differently about doing the job.